Good morning, everybody. I'm glad that you're all here. We're going to get started in just a couple of minutes. Let's give it a little bit for folks to join. I know that I have some folks who are waiting in the lobby, and then it will say admit, and they'll say the admission didn't work. So I'm just going to give it a couple more minutes so that people can fix any technical difficulties they might be running into. It is a beautiful, beautiful day out there today. I hope it's as beautiful as it is here in your location as well. It also makes me jealous that I'm inside and I'm not outside. Oh, I look and see, and we've got a wide group of folks who are joining us from all over Wyoming and Montana and Idaho today. I'm very happy. I'm thinking about some really bad dad jokes, so I'm going to tell one before we get started too. And a man goes to the vet office with a dead bird. His canary dies, and he's like, "Doctor, you need to take a look at this canary and do something for him." And the vet says, "Sir, your canary is dead." And he says, "No, he's not. Check again." So the veterinarian goes and gets his house cat and brings him in, and the cat sniffs the canary and walks away. And he goes, "Sir, I have to tell you again, I'm very sorry, but your canary is dead." And the person says, "Listen, no, you're wrong. Check again." So the vet goes and gets his dog and brings him in, and the dog sniffs the canary and walks away. And the vet turns to the guy and says, "Sir, I am very, very sorry, but after the CAT scan and the lab tests, I have to tell you, your canary is dead." Bad joke, right?
Do you know when a regular joke turns into a dad joke?
When everyone stops laughing?
When it becomes apparent.
Oh, that's a good one. That's funny. I like it. What a play on words. Well, welcome everybody to the Data Management Series. We are so happy to have you here, especially since this was a continuation of our April series. We're so happy that you're able to make it in May as well. So thank you so much for coming today. And today we're going to talk about digital signage. My name is Jennifer Hudson-Schaff, and I will be your facilitator today. And if you have any training requests or any questions about training, you can give me a holler and I can help you out with those things. During today's training, just be aware that you'll be recorded and it'll be used for future training purposes. Your participation on or off camera or through audio or through text in the chat box indicates your consent to be recorded. And then one of the things that I try to do is eliminate any personal identifying features within the recorded version. So even though we're recording right now, there's a possibility that your name or your image could come up, and that's why we just want to keep it in mind that you're being recorded. During today's training, you can use the chat box to please sign in, name, title, organization, and email. And also, if you could be so kind as to use the chat feature to post your questions or use the raise hand icon to ask any questions. Please mute your phone when not speaking. However, if the time presents itself and it's like a great time to ask a question, and you can also unmute and ask your question as well. And then, again, the use of cameras is optional. We'd love to see your smiling and beautiful faces out there, but it's not it's not required. So yeah, if you would like to turn your camera on, perfect. That'd be great. We share the resources afterwards. So be on the lookout for the recorded version and any other resources that we send out. And you can also forward those resources onto anybody. And then I keep saying this, but the evaluation will eventually come out. It's low on my priority list right now, but I'll send out an evaluation probably for the end of the entire series. And I just want to say welcome again to everybody. Thank you so much for joining us. And we have a guest here today who will be doing our prayer. Miss Mary Louise, would you be so kind as to lead us in the morning prayer?
Creator Father God, we just thank you for this day. We thank you for each participant here, that we get what we came here for. Clear our minds and our hearts as we all come together today. looking for the wisdom and knowledge and understanding from this training. Has to continue to love one another, forgive one another for this day. Amen.
Oh, thank you so much. Thank you. Thank you. So, Miss, I just want to say hello and thank you to all of our guests here today. We're going to talk about health communications and digital signage. And Miss Jamie with the CDC, she's going to share her screen and take it away with the health communications part.
Thank you. Hello and welcome. I'm Jamie and thank you for joining today for our presentation on health communications and digital signage. So health communications is a process rather than a product, and the objective is to create clear visuals that tell a story, and keeping in mind the audience, the message, and the agency when deciding on content to present. And today we're going to focus on content with examples that could be curated for digital signage. So target audience. The target audience is the group you hope will both understand and use your information, keeping in mind who is this for, what is important to them, and what do they need to know about this topic. So the target audience influences things like topics, forms, tone, visuals, examples, and place and time of the presentation. So it's important to assess qualities such as values, vulnerabilities, fears, concerns, interests, and enthusiasms in a target audience in an effort to better understand them. And here's an example. This is artwork done by Dale Ray DeForest, who grew up in the Four Corners area of Navajo Nation. And the target audience here would be individuals in the community. And you can see the messaging is wash hands, physical distancing, and be safe. And I thought these graphics were so beautiful that were done. So determining the specific purpose. So consider the specific purpose when generating new content or curating existing content. And consider what will be digestible to an audience as digital signage, for example. Will it support the general purpose, the specific purpose, and is it specific to the target audience that you're trying to reach? So here's an example, and this I think is done from Albuquerque and the Southwest Tribal Epidemiology Center. You can see the website there. And a general purpose could be to reduce the spread of COVID-19 cases. A specific purpose of this image could be to promote face mask wearing in the community. And it promotes wearing a face mask as a positive act of love to protect other loved ones in hopes to influence the target audience, community members. And it got a little jumbled on the slide, but this is also basic do's and don'ts of cloth face coverings. And that can be read more clear by visiting this website. They have lots of great resources on there that I believe are public domain. Okay, so questions to think about when you're crafting these messages for the target audience. So the message is information presented in a way that communicates to the target audience the importance or relevance to them. So for example, why should I care? What impact will it have on me? And what do you expect me to do about it? And that's often called the call to action. And call to actions can also help people feel more in control of the situation as well, giving them action steps to do. So here are some examples of identifying clear and specific messages. And these are hand washing examples. Some are from Johns Hopkins Center and some are from CDC. And this is also a sign that was near my house that I saw. So just asking from looking at these slides, can anyone identify the least specific message here? We're trying to look for messaging that could not be misconstrued. And I'll go ahead and give you a hint. So 20 seconds of what activity can help prevent COVID? So on this sign right here, it does have an image of hand washing, but it's a bit unclear, right, that we really want 20 seconds of the specific activity of hand washing. So kind of keep that in mind of when you're looking for content, can it be misconstrued and is it as clear as possible? And I appreciated the image here on the bottom. This is a bucket for washing hands. So this could be useful for households that may not have running water. And just keeping in mind, not wanting to misinterpret any messages. So considering emotion with these health communications materials, emotion can help craft persuasive messaging. And when you do use emotion, it's optional. You'll want to avoid coercion or manipulation by avoiding invoking too much fear. And as also always be mindful of cultural sensitivity. And if you're unsure, positive messaging is a good place to start. And it's not uncommon to see elements of emotion in health communications messaging when crafting these persuasive messages. So here's an example, and this is for smoking, one by Montana and one by CDC. So smoking can be a challenging behavior to change. And considering emotion here, the image on the left depicts a positive message of hope for youth without tobacco use. And the image on the right depicts a message aimed to cause concern of smoking and impact on youth. And both messages target preventing tobacco use, but in different ways. And considering emotion is ultimately a judgment call based on the circumstances and the target audience. So this CDC Tips from Smokers campaign is among the few CDC campaigns aimed to evoke more fearful emotions. And this may be because CDC has tried many other tactics to prevent smoking. So communicating in emergencies. So people in high stress events are more likely to hold on to their current beliefs and may look for additional information outside of the information that you're giving them. And they may believe the first message they received, whether that's messaging that you're providing or something that is completely non-credible. And so it's useful to keep in mind for emergency situations the importance of empathizing with individuals affected by an emergency, and that can help build those connections and communication. And again, promoting action and action steps can help people feel more in control of the situation. And it's useful to listen and take in feedback and evaluate how this information is being received. So before I move on, do I have any questions so far? Oh, go
There's
ahead.
nothing in chat either, so yeah, go ahead.
Okay, great. Thanks. So with that, I will go ahead and hand it over to Sundak, who'll go over digital signage setup and ways to curate and store images for digital signage, and also going into a real-life example as well. Thank you.
Well, thank you, Jamie, for giving a good introduction. And my name is Sundak, and I also work at CDC as one of the instructors for this course, along with RMTLC. So we are going to, and I also was in Fort Belknap for almost 3 months. I was working on the community testing project. I was in person as well as some of them virtual. So I'm going to show some of the examples from Fort Belknap. So it's a little bit more tribal settings. What can we do for digital signage, and how can we communicate? I'm going to, yeah. So I'm just going to use an example here in Fort Belknap. We were doing the Binex testing actually originally was for, this is the project we had actually. So they were in that community, there was, it took some time for getting the PCR test results from the state and other stuff. So Dr. Burks was actually chose one of the, I think 4 or 5 tribal communities to let's just go and actually do a lab testing actually in these communities so that we can do a rapid testing and then we can give the results immediately. That's one of the main goals so that we can prevent the transmission. And then also the other reason was actually is we want to do a community testing to see instead of just doing once every few weeks or something like that. We were trying to do it maybe for continuously do for 8 weeks. That was the original plan. So that's what we did actually. So in Fort Belknap, if you know, many of you know, just there's it's relatively 3 main communities are there. So and we parked these trailers. We can see the trailers here. So we took these trailers and parked in 3 different locations and we were doing the testing. And then this is the Binex testing actually. So you just, it's very simple testing. It's not like PCR where you have to do a deep throat swab. So this is just more in the front, just nasal portion of it. Just you have to do those things. That's the testing we were doing. So that so we were doing recruiting the participants for household testing so that if they would be willing to participate in a weekly testing. And the other ones also people can drive by these trailers and do the testing. So, and I'm going to use the context of digital signage here. It doesn't need to be shown on the TV. How we are actually using effectively to communicate with the people, what did we do actually, where we are doing the testing and what's the importance of testing in those sort of scenarios. These are simple examples that most of you could do. These are, we just simply use a Google related products because most of them are aware about actually using it. So we actually use Google Maps and others. We'll talk a little bit more in detail. And then this is just one of the communication slide. What we did was there was a flyer we created here. You can see on the right side in this telling about testing we are doing, and then the results will come in 15 minutes and we'll tell them whether it's positive or negative. And then also when we are communicating the results, we do tell them at this point in time you're negative. So we kind of to say that some of them may come earlier for testing right after the exposure. So we are actually depending upon the history, we ask them to come back again for the testing as needed. And then we also been communicating all these test results to the nurse, even if they are negative. Sometimes if they have an exposure and if they have symptoms, then we would tell them the tribal public health nurse so that they can follow up for any PCRs or just maybe keep an eye on them for repeat testing. So and since we were doing for 8 weeks testing and we were doing in different locations on different days, we need a way to communicate to the community members where they are. And some of them we can do in the household, some of them may go to work. So we had these trailer locations on different days and different timings. So we need a quick way to do it. So we actually created this flyer. Of course, we put the hard flyers in grocery shops and those sort of things, typical things we did. In addition, we also created a simple website we created. That's what I'm going to show you in a minute. This website we created, and then that we provided the information related to locations in all of them. The main thing is we shared it with this particular location, this website link with the existing sites, like, you know, Fort Belknap has a tribal website there. They had it there. They had a Facebook there. So we provided the link to this one. Instead of updating all these things, we tried to just had a separate website so that it provided the links for them. Same thing with the radio announcements were there. And then also in IHS websites or Facebooks, we did those things. So that's what I'm going to show you briefly, how we manage the schedules. So people may not have during emergencies have time to go and update, have a web developer to come and do the updates for those. So basically we try to use simple things. You update your slide, it automatically, the website will get updated. So that's one of the first examples I'm going to show you. So, and then also I wanted to give you, at the end of the 8 weeks period, we were almost CDC deployers were about to come back. So at that time, Fort Belknap, one of the high schools had a basketball game related outbreak, varsity basketball game related outbreak. So we ended up actually testing, actually mass testing in a sense. The testers, we went there, sat in the school, and with the help of the school staff, we did the testing and then provided the results to them. And of course, if they had any exposures, we followed up with their families too. So that's what the picture you are actually seeing here. And then we worked with the Phillips County, and then school, of course, provided the messaging related testing. So it's also really the communication to tell the parents and the families or the visitors who may have come from them for playing the games. So there was a wide variety of outreach was there. I wanted to show the example here was, in this case was, you can see this one we created, because since it was a basketball related outbreak, so we have to create some material specific for basketball related communications, because a lot of the youth were there in what youth sports related to it. And then also it's not just for the high school, but also for the other visiting schools too. So I'm going to show those two examples. Okay. So this is the first one I wanted to show you is the testing aspect of it. This is the first one we did was we created a simple page using the Google website. We created a Google account for this purpose. So generate Google account. In this one, what you're seeing is really a slide. Whenever we update the slide, it automatically gets updated here. So that's what you're seeing. So it's really the people are not really updating the website. So they had an access to update the slides and then or any Excel spreadsheet or Word document, whatever it is, it automatically gets updated. So this was a little bit easier. And then also we also did brief YouTube videos, like for example, just we want to let the community know it's not really a difficult test, it's a really simple test. So we provided the existing video clips, like most of them are just like a 2 minutes video clip. So we try to provide them on the same website. Basically all we did was really put the links there. Google allows you to show them as a video. So people, when they see the schedule, they also given the information, this is a relatively simple test, so they can be aware about it and they can come. And then also you have provided some other things too, how it actually helps prevent the risk of spread with the Binax testing. In some of the schools, we were also been doing testing, and some of the kids who were exposed, and we want to make sure that they also can come for the testing. So you can see in the school setting how the Binax testing was done. It's just a short, all of them are 2 minutes video clip. So they can just see what things are there and then look at those things. And then, of course, we provided other video clips as needed for school settings and demonstration of how the test is being done. So it's, again, this is just a simple example, what we did with just the lab testing. So this also kind of considers a digital communications, and people can see on their Facebook or whatever the things, their devices, they can see. And then this is the one we did actually was for the digital signage for basketball. Specifically what we did was, so we know that that basketball in most of the tribal communities is a very important activity, that they were participating, both visitors as well as parents and in others too. So we provided some resources for youth basketball. So it's kind of covers in generally what sort of guidance we provided them for those resources, fact sheet as well as the website. So those resources are helpful for the coaches too, so in case if they need to refresh. But we also provided, they all were playing varsity. So varsity and then NBA, they all had nice resources related to this specifically for basketball. So they would tell, so during the break, how they would keep the benches and how they would do all of those things. So you can see those are the things we put them in there. But even though all these resources are there, we do wanted to come up with a quick slide set. So what we did was we created a Google Slides, and we took some slides from the CDC's website and we put them there. So all we did was embedded the slides here. Anytime you can update the slide, it automatically shows up here on your website, or people are displaying it on their TV, whatever the things are, maybe in the high school if they are showing them before the basketball game, or while people are coming into the basketball gym, they can show these things too. So whatever the ways are, so it's basically a simple slide, and you can put them in whatever ways you can do. You can download the Google Slides and put them on a thumb drive and put it on your computer, whatever ways it is. It's just simple, common ways that you can use. So existing slides that's still applicable for basketball. And then and the same thing also is for a digital signage, you know, some of them actually, you can see, you can adjust the timings too for these Google Slides. One of the nice advantages, Slides allows you to change the transitions and also how often you want to change. Sometimes you don't want to change it every 5 seconds or 10 seconds. So depending upon the content, you may want to leave it for 10 seconds or 15 seconds or 30 seconds. I'll pause after this, and so we can have if you have any questions, we can talk through. And then also, we also gave the options, right? So not everybody is going to use a Google slide. They may not have internet connections. So school may or may not have internet connections. Even IHS settings, sometimes in the clinics, they may not have. So we provided the same slide set in the PowerPoint, so they can download it and use it wherever they need to use it for offline purposes or posting somewhere else. Or if they need to modify the slide to put their specific community or tribal setting, whatever the things are there, they can put them in there. That's one of the reasons we gave them just a PowerPoint file link. Or sometimes it may be just image, right? There may be a handful of 4 or 5 images we made. So those can be just the same PowerPoint slide. You create the PowerPoint slide or Google slide, you can save as images. And you can save those images into your Google folder. So you can give it to them so people can take it and use it whatever the ways they wanted to use it. That's another one. And some people actually use the animated GIF link. So basically, if you have 4 slides, you can animate them as one image. Sometimes it may be difficult to show them in some of the browsers. It may or may not be work. So it's not, you have to play with it and see. And then the PowerPoint slide also, the same PowerPoint slide, in addition to saving as images, you can also save as a movie. Like you say, for example, you can time it as if like you're presenting to the community, or you can also, somebody can talk through it. To some slides, or most of the slides are infographics, you may not have an audio. So people can talk to it and record them on the PowerPoint slide itself. And then you can time it accordingly, right? So same content, a local tribal leaders or local coach talking about this, encouraging people for testing, that's much more powerful. It's the same slides, but they're talking through it, encouraging them to do the testing. So those sort of things would allow you to do. So you can, once you record them, you save them as a movie file. It allows you to save them as a movie file. So once you have a movie file, then it's up to your imagination. You can send it to in a Google Drive, or you can upload to your YouTube. So whatever the things are. Again, these are short clips, so you should not have any problem doing it. Sometimes what also do is the same PowerPoint slide, the Google slide link, you can share it with others, right? So it allows you to it gives you a small set of codes you can see here. So when you, in the Google slide, when you click on share, it gives you an option. Oh, copy this, and then you can put them on your website. You can work with your website developers or somebody else. You can work with them and put the content there. So I'll pause here for a second before I go into the devices. So I want to see if you have any questions on content creation. Okay, so I'll continue, and again, we'll have some more time for discussions after at the end. So one of the things I've been exploring this digital signage was, I have in Atlanta, there's a library, Fulton County Libraries, there's some MLK, Dr. MLK's library is there. So it's in a setting where you have a lot of homeless and in lower socioeconomic settings groups, they come there actually. So there we tried a lot of different things actually, trying to do these things while they come during the daytime and sit in the library, they read the newspaper, they do these things, and so we thought actually, so let's just try to explore these things and show it in the TV. We had a dedicated TV there, so we tried to not just show all the health communication materials, we would actually show them some things. Like at that time, I was using an example, Dr. Aretha Frank, actually she passed away at that time, so we tried to show her clips in between, and then a news that was going on that day. So whatever the things were there, we tried to show them, because most of them had YouTube presence, whether it is a CNN or any other news channel. We'll try to show them in between news and then health communications, try to mix it up and use. So there we actually used it, again, we used simple devices. We tried with the simple, these are the various devices you have. There are a set of devices, you can use it. You have to have an internet connection. Online display, it requires some sort of a Wi-Fi. So Wi-Fi was a little bit challenging there, because sometimes a lot of them come to the library just for using Wi-Fi. Sometimes the receptions were not clear, so it would kind of buffer and it will slow down, and it was kind of a challenging with there. So these are the devices. They usually, most of these devices are relatively cheaper. If you have a good internet connections, if you want a dynamic way of managing the content, updating the slides remotely, you may not need to be there in Montana, but you could be there in a different place. Say, for example, RMTLC, Jennifer could be in Wyoming and can update the content for your place. If you have a Wi-Fi connection, all she has to do is go to the central place and replay the slides, move around the slides, or adjust the timing, whatever you need to do. So these are the internet-enabled devices would allow you to do, but the only challenge was these all would require some sort of a subscription. Most of them have $10 to $20 per month. Sometimes if your tribe, they may give discounts for public health aspect of it. You have to work with each vendor. So there's a whole list of vendors so that if you type in digital signage, you would get a lot of different vendors. You can work with one of them. I mean, those sort of things you could try to do. So people have used Amazon Fire Sticks. A lot of them have Amazon subscriptions are there. Amazon Fire Stick seems to be the best one, at least for people if you really wanted to manage with the internet connection. That really works well. And then again, you don't need, the one challenge with this Amazon Fire Stick is you don't need to have a subscription for Amazon, but you can create an account. You still, somebody within that organization need to create an account. And initially it was asking for a payment card and all of them, but I think later on we figured it out. You don't need to put a payment card. You can still create the Amazon account and then buy a Fire Stick, and you don't need to buy a new one. There's a lot of used ones are there. So they still work good actually for these things. You can get in eBay and other things for $10, $15. You can usually get for these purposes. It doesn't need to be a latest device. Same thing with Apple TV too. There's a lot of old Apple TVs are there. So, and it allows, as you know, Apple TV allows you to image anything on your screen. You can also play something from there. And there's a lot of apps that you can put on Apple TV that allows you to display these content dynamically. In other ones, if you are more of a Google and YouTube and that sort of content is there, Google Chromecast is there. But again, Google Chromecast is a little bit challenging. In some settings, the Chromecast setup itself, they won't allow you to do it in some of the networks. Like, for example, if I try to put them in an IHS clinic network, it may not work. Or even in CDC, I try to put them in, it wouldn't allow you to join in the network because it's trying to join as a device. So all these devices have their own unique challenges. Roku Player seems to be okay. It does play some of them offline too, but it's still limited. And then advantage with Roku Player is you have a lot more channels are there, like a lot of free TV channels are there. So you wanted to kind of in between, if you're in a clinic and outpatients, you can actually use it for a few things related to news clips, and then change some of the communications. You can sequence them and time them as needed. So those were the ones, but none of these things worked out. When I was in Fort Belknap, I was trying all of these things, but I know the internet connections, they were having it, but not for the guest. So, and then these devices really didn't work. So I tried, the other option we tried was Intel PC stick. So I was using in one of the libraries. So it's basically a small, almost like a USB drive. That's all it is. This entire PC is there. You can put it behind the TV, and then and also have a small keyboard is there. You can type it in and change. It's almost like a PC, nothing different at all. But the challenge was PC stick. I mean, one time we picked up in the library, somebody took it away and went. So it was so small. If they know that, they can take it and go. So, and also it can be a little bit challenging to use it. It still requires internet connections to some extent, but it's like almost like a PC stick. You can hide it behind the TV, it would still work. And even if it is an offline device, you can work because it's like almost a mini computer. This also, you can get a used ones you can do. Even if you don't have internet, you can do this. If you're going for a community setting, you take the Intel stick and then a PC stick and stick it in, say, in a casino or someplace, wherever you're going. All you have to do is stick it with the HDMI port. That's all they have. You have to stick it there and it should work. So far, the best analysis we did was with the Mica media player. It's from Amazon. You can get them in. I don't know if other places they sell them in. And you get used ones for $20, or the new ones you can get. And I provided the links on the slides too, and I'll show it to you in a minute. But those ones are the ones just relatively easier. So all you have to do is it has on the back end USB drive. So whatever the content you want to put them in, whether it is a video or a movie or a picture, whatever things you want to put them in, it doesn't play PowerPoint. That's a big difference between the PC stick and the Mica media player. If you really wanted to play your PowerPoint slides, then you may have to go with the Intel PC sticks or some sort of a mini computer there. But if you really wanted to save the PowerPoint as images or videos, and it has a remote too. It's a small device. It's like you can fit in your palm, and you can stick it behind your TV. It also has a remote, so you can change the images or whatever the frequencies you want, shuffle them, well, just like any other image player or videos it'll play. So those are the devices you could actually relatively use, and you don't need internet connection. Absolutely don't need. Only thing is the content, and usually don't change that content very often. So you may have some images related to Breast Cancer Awareness Month. Maybe that week you will promote them, and some other week you may have different things. So I don't anticipate a lot of the things changing often, but you can also use it for displaying any events that you may have, right? So you might have a diabetes education related things. You can also allow it to show them. It doesn't need to be always health promotion. Also say lab testing or COVID cases you have in your community. Those are the stuff you may not want to put them on a website, but for your community, you can show them just these sort of small things you can do. I'll pause here, see if you have any questions related to more of a hardware and usage aspect of it, and then maybe you all can share if any challenges you all have faced it in your settings, whether it is a clinic or it is a community center in other places.
So the sticks would show the images as if they're like a VCR or DVD, or it would be like another unit attached to the TV.
Yeah, it's a very small device. It can fit in your palm of your hand. So you can, there's also a Velcro is there, so you can attach it behind the TV. Nobody will know, actually. The nice thing is you can take it away wherever you want. And just like you can attach to your projector, you can attach to whatever the devices are. And the nice thing about micro media players, you don't need to use a newer TV with the HDMI connection. Even if you have an older TV, those composite cables where you have a yellow cable and the red and white for the audio, it would work with any of those things too. It doesn't need to be sophisticated. So you can always get the used TVs. A lot of them actually people all go for newer TVs. You can really get a used ones and reliably use it. So it should not have any problem at all. And if you have a new TV, I mean, some private clinics, if they have a newer TV, some of these, like for example, Samsung TVs and others, they do have a USB drive. And I know Samsung is one of the TVs that for sure it is a smart TV. It allows you to, they even have a digital signage app on their things. So you can put them in. That may cost a little bit more for the TV, but you can put you can manage, you don't need to plug anything at all. So you manage a website in Samsung website, you create an account, you manage all your things, and it'll automatically show it on your TVs. So again, those are all requires a little bit more investment for the TV and all of them. And then some of the smart TVs, latest TVs, they process the images. That's not an issue at all. Just like the way we see the photos, right? Family photos and others, you stick it to the TV, right? That sort of things you also can use it too. So Jamie, do you want to talk briefly about this slide? So I just want to let you talk about this.
Sure, absolutely. So this was also an example from that COVID-19 real-life situation involving basketball. And keeping with the sports fan concept, this is an NBA campaign encouraging people to receive the COVID-19 vaccine. And a new idea such as a new vaccine needs to be adopted by enough people to be self-sustaining and helpful to utilize social influencers for public health messaging. Full videos can be found on the NBA website, link provided below. And so behavior change influencers is a common behavior change tactic for opinion leaders to try and target those early adopters and people who are going to be the early ones to receive the vaccine. Thanks.
Yeah. So and I'll show you the slide just in case if you want to show NBA website. Yeah. Yeah. So most of the sports fans, if they are playing NBA or in basketball, they usually visit the website. So we're providing those links will help them. So yeah, this is another way, like when I was there, I saw most of the public health settings, they have these boards, right? Typically the boards are there with, they'll usually put some promotional materials there. Now with all this COVID situation, it's even more challenging. People are not coming to the clinic, so they're not going to see these ones. So you need to find a way to still reach out these materials to others who are not coming to clinic and who are in quarantine or whatever the situation is, right? That's where this is an important information that you can take these materials and then actually translate them into a digital way and push it through the website, Facebook, or TVs, whatever the ways you can do, depending upon those things you can and work through. So again, the content is up to them. You can actually even show your tribal dashboard. Some of them are very sensitive about the data they don't want to show outside. That's okay. You can put them in your own tribal communities. Some places you can put them as a simple signage actually. So it should work. Whether it is a tribal colleges or casinos, wherever you need, where people are going. Could be even a grocery store. So wherever you need to put them in, you can provide these things. And then this is just an example just to show you that while people are waiting, most of them, they'll wait in the registration room, or especially if the vaccination they're doing, usually wait for observation for 15, 20 minutes or 30 minutes, they'll wait so they can actually see these things and while they are waiting, so you know what to expect after vaccination, what side effects they may get. And also show them a V-safe, right? Vaccine safe, just register them, give them instructions, what sort of things there while they are waiting. So it's very powerful. So this is the one I talked earlier about. You can see just the size of the device is very small. And then the Intel PC stick is just like almost like a USB drive. Only thing is it doesn't have a USB, but it just actually has the HDMI port in it. And then also many TVs have a USB connection. So you don't even have a power supply. You can connect to the USB for power supply. But some of them, the device gets heated up. So you better just generally try to connect directly to the electrical outlet. Same thing here with the Mica device is what I was showing you. You can see here it comes with a remote. It's a very small device actually. So 3" by 2.5". That's all it is. It's so lightweight. And you have a USB drive here and you have a HDMI connections. And then you also have some of the old TVs you can connect to those cables you can do. Yeah, and then it has 2 USB drives. So for some reason, if you wanted to use the device for another one for controlling a mouse or something, any other device you want to connect them, you can do. It also has a micro SD cards because micro SD cards are small. It also doesn't project out, and it also you can put them in a content a lot easier. So you can put them in there so it'll stay there. But of course, the challenge would be is unless you have a micro SD card reader on your computer to transfer the content. So it may or may not work, but if it stores a lot of things, you won't even be seeing. It just goes into the slot. And there's a YouTube video link we have given that tells you just a short 3 minutes video. It's just an example to show how to set it up. So we'll be able to see those things too.
And after this call today, I'll send out a PDF version of the slides so that you can click on all of the links that have been provided.
Yeah. So Jamie, do you want to talk about this slide?
Sure. So these are just some data visual quick tips. Since digital signage can also be used for displaying surveillance data and information. So the objective is in these images is to create clear visuals that tell a story. Here are just some quick tips to keep in mind when creating data visuals. And you can go ahead and read them. So and we're going to show you some visual examples, but in general, you don't really want to use 3D figures. You want to stick to 2D figures. And you don't really need a box in your data. You can just display the X and Y axis. And I'll go ahead and go on mute because someone's mowing their lawn right next to me. So sorry about that, but thank you.
Yeah, again, just those are the colors also you may want to use. The colors are important actually, especially for digital signage. You want to use some sort of color that is appropriate for everybody else, even for visually challenged or elderly or anybody else. Just you wanted to make sure more of a 508 compliance. And bright colors are really usually not usable. So backgrounds can be either white or it could be just dark colors. Just either those sort of gray color, you can use it as a setting. So in that way you can put the images so you don't need to change your backgrounds often.
Yeah, and as a tip from an education standpoint too, is you want to keep from using red or green for any of your text because there are a lot of people out there who may not be necessarily colorblind, but also have that blue-green that red-green blindness, so they won't be able to read the letters as well. And then when dealing with people who are older, make sure that the background is not so dark because then it's so hard for them to read the actual text. So you want to stay with light colors for background images for people who are elderly, but for graphs and things, definitely stick with really bold colors.
So we do have a good digital signage guidelines actually within CDC. We have different programs and buildings spread across, not only within the same city, but also in different cities. Like Rebecca is from Nyasha, she is from Cincinnati, Ohio, and then others are all in different places. We are there. So these digital signage slides are useful for them too. So we have a template is there. What sort of things you can actually, it's more of like a best practices. We use it for internal aspect, but I'll see if I can print them or save as a PDF. Their general templates are there, so I'll be glad to share it with you, Jennifer. So if you wanted to use it for creating a PowerPoint, infographics for printing is different from digital signage. I'll say you don't use these colors, use this size font, don't keep it busy, that sort of the things. Those of general layouts are there so that you can also find it in Google too, but I think these are the things that we've been using it. So you may want to come up with the template. So for your own organization, leave everything else just except for the content alone. People can populate them. So that may be easier so you don't need to start from scratch.
That would be awesome. Thank you.
Yeah. So it's not their outside external wall, but I think we can definitely share them. So I think these are the three examples. I think I already talked about the lab testing. I'm not going to talk about that one. But also these two examples are, I think I wanted to share it with you, was one is to know about, say in this case, Fort Belknap example. We don't want to share exactly what number of cases are going on, exact counts, because sometimes it may not be appropriate to share them. Some communities don't want to share some of them. They are okay. That's example I'm going to show you. How did we come across instead of using the tribal data? So all we need to know is give them a situational awareness of what's going on in your community. And then we would actually try to use the county data. County data is public and available from most of the states. And then we try to focus on the county because most of the tribal communities are spread across more than two counties or sometimes 5 counties. So we try to provide them, all of them where they are, and then we'll show an example of what we have created. And then also I'll briefly talk about the vaccination too. So let me talk about this one first. So what we did was we didn't call the Fort Belknap specific related to the things. We call it as a Fort Belknap area. So let me actually just maybe make it as a bigger slide just so you can see. One of them is you can actually, so Google actually provides a nice link. So you can zoom into it, like Fort Belknap is there. So whatever the county you have, you can look into it and then see this is the reservation. Fort Belknap reservation is there. It shows all the surrounding counties. Again, the thing is when you're providing this, you want to make sure you provide the date. And I'm using one of the older slides to show that one. You don't want to leave it without the date, then people would not know what date it is. So you really definitely wanted to make sure you use those date as an example. Just put them in what timestamp it is so they can see. And if people wanted to see this on their phone while they are waiting in their clinic, in these scan, the QR codes are there. So you can actually put them, even if you want to put them on in a grocery store or any other place, just print this to know the cases before you travel to the nearby counties. Most of them, they go out for school or grocery shopping outside the county. So it's really, we wanted to provide what's happening surrounding counties so they can decide where to go or just take care of those precautions in that sort of things. And we can see these are the 0 cases where there positivity, then some of them actually have high. So they can try to do the same thing, not only for the county level, you can do the same thing for the states too. But also you can want to simply give a simple language. You can just say that level of community transmission in these 2 counties, like Fort Belknap, this majority portion is Blaine County and this one is Phillips County. So you can see that one and give them an example what's going on in both the communities. In this case, we provided transmission was low, but if there was 2 different type of transmission going on, then you may want to provide them specifically what they are so that people can relatively look into it. Again, the date is quite important. And would be useful. And also people, as the summer goes and people wanted to start traveling or spring comes, they may want to travel. So again, you may want to provide them at the state level if they're planning to go for any other travel. So before 1 or 2 days, at least the day before, they can check and see where things are. So they may change their mind. Instead of going to South Dakota, they may go to Idaho. So what are depending upon the situation. And also it's useful for people going for these Google Maps for entire US is there. So when you click on it, actually, it takes you to, let me show you, click on the link. So this is the link. Actually, you can see this entire thing is there. So if I'm planning to go for Disney World, I want to go to Disney World in Orlando, all I have to do is just move down and see what the Florida situation is. You can see those things. Or if I'm trying to go to Los Angeles, I can look at what's happening in Los Angeles or in California. Sometimes it may not show, but you have to zoom in so to see the counts. So you can see there was a 4.4. So you can just decide your destinations and accordingly you plan. So these are simple things. All you have to do is only one time. This QR code, you have to post them wherever it is. It could be a clinic or in other places, and whatever you want to put them in, check before you travel and that sort of thing. So whatever verbiage you want to put them in, you can put them in depending upon the things. All you have to do is zoom in, and then and I'll show you a way how to take the QR codes. So in this case, for example, let me actually click on the Fort Belknap one example. So let me go to the Fort Belknap. So when I click on Fort Belknap, so the way you would create them is once you use a regular Google map, right? Once you go to the regular Google map, there is an option for you called COVID info. That's where you would enable them. But in this case, I already enabled the link with the COVID info, so it's already showing them. So whatever the areas you're in, you just look at these ones, whichever the areas you want to focus in, like you may want it to share these counties, different counties, you can move it around. Once you move it around, what you need to do is go to the Google browser or right click on it. If you're in a Chrome browser, you can right click on it anywhere and you can do those ones, or you can see when you click on the address bar, it gives you an option for create QR code. So you can see those squares and it gives you a QR code. That's all. For any web page, any site, you can easily create the QR code. So you can download. So you can, when you download it, it gives you an image. All you have to do is copy, right click on it and copy and paste them in your slides. Wherever you need to do, you can put them in. It's very specific for any URLs. So you can use it. It can be used for any pages to say, for example, if I want to put I created a Fort Belknap area information, I want to put a URL for this one. All I have to do is right click on the page and click on create QR code. Either click on the address bar or click on this one. So that way it's just totally free. You don't need to worry about any of these things and you can put them in there. So these are the different ways. So that's what I was showing you in this one. You can see the slides actually show you not only the Google things, but also the other things you may want to do is most of the time people wanted to see, most of the counties, they do post them on their Facebook about the cases, what they were seeing, like once in 3 days. They may not post every day depending upon the active number of cases. If they are more, they will post them. But now its frequency is getting reduced because as active cases are reduced. But again, the key is you wanted to capture the post as from their Facebook, right? You don't want to modify them, anything else. Just take a screenshot of it, whatever they posted them there, you put them in here. Again, these are things you're doing it as a slide, Google slide, right? When you update the slide, it automatically gets updated wherever people are seeing it. So you can see the date and whatever the things are there. And if they want to go to their Facebook, the same thing with the link is here, right? For the Facebook is there. Or you can actually, if you have a QR code, you can, again, for any web page or a Facebook, you can create the URL. So people can just, they don't want to type, they don't want to click on anything, just they can do those scanning too. And then also some of them, this is just an example for us. We showed the CDC data tracker is there. It tells you for 7-day average. You can see, you can adjust the timeline. You can move the timeline. You can just see whatever the things. Again, these are county data that's coming in. You can click on this one or use the QR codes. And this is also another useful one. You can see Johns Hopkins provides a dashboard. It's all you have to do is paste one time in your website. It automatically updates. That's all you do. For example, in this website, if you see here, I provided the link here. Only one time I did about 2 months ago. It automatically gets updated, shows you last 14 days what the transmission rates were, what the cases were, and then and it just keeps maintaining it. You don't need to do anything at all. So it usually takes care of it. If in this case, there's 2 counties involved, so Blaine County is involved, and in the Phillips County is involved, so people can see both of them. Only one time thing, you just have to paste them in. Whether you're putting it on a Google site or on your any website, it just provide the URL. They are very dynamic too. You can see the racial distribution, state case, and everything else, and the hospital beds and number of cases. These things are also there too. These are relatively small things that you could do. So that's what, let me stop here before I go to the second example to see if these things some of these things, whether you could implement them. All you have to do is create a Google account. It doesn't need to be a personal account. When you're creating a Google account, you may want to create as a business account, and you don't need to attach anything at all. So you can create a general email, and you can share the passwords with whomever you wanted to do. So you don't need to use your personal email. And then accordingly you change them. And if it is a group account, change the passwords as often, or give with a certain group of people what they need to do. I'll stop here to see if you all have any questions.
No questions in the chat so far.
Okay. Yeah. So I'll go with the next example, with the vaccination example. So I already clicked on this vaccination example. This is not in a tribal setting, but this is an example that will help you to understand what we have done. It includes not only the digital signage, but also the concept we learned earlier 2 weeks ago about the Kobo toolbox as a way to collect the data easily. It collects the data collection. If you all haven't attended the webinar, Jennifer can definitely send an email with the recording. So what we used in Fort Belknap was, we know that when we are going to collect the data in a household testing, they may not have the internet access, or cell phone signals may not be there. So what we did was we used Kobo Toolbox as a device from Harvard. Is a simple data collection platform. In Harvard Humanitarian Initiative, they have done these things. So we used their platform to collect the data, and then we stored the data on your device. The form data would be stored on your device, whether it is a cell phone or your tablet or anything else. And then all you need is a Chrome browser. Of course, they have apps also, but you don't need apps. So you can also use the Chrome browser, and then it stores the data, and then you go, whenever you have internet connection, it automatically uploads. So that's the same example here we used for vaccine in distributions in Milton, in the city that we worked on. I live here. So the thing you can see is, what they did was they were doing paper forms they were doing. So the firefighters were giving vaccinations, the paramedics, they were filling the paper forms and then taking a picture of the license or insurance cards, and then they were sending a text over to the pharmacist here who was providing the vaccine for them. And then they were actually entering all these data into immunization registry or whatever the things they need to send it to the state and other, or county, whatever things. It was very circuitous. It was a lot of paper data entry, and also they would not know how many people are planning to come and everything else. So we basically used the form, like, the form that we created was Kobo Toolbox. You can see that one. It's a simple form that we created. We went over those things last time. So, and then the other one was, people sometimes may not fill the form. Sometimes before they come to the site, they're still hesitant about the vaccine hesitancy. So what we also did was similar things, same as we created a simple Google site. So when you click on it, it goes to that one. We try to provide them, if you want to pre-register, same QR code aspect of it. You can right click on it and create a QR code for any URL, right? We did those things there. But also sometimes some of the phones, some of them, they may not know how to open the camera and create the QR code. So if they are waiting in the line, sometimes it may be easier to tell them a short URL. You can create a short URL to type them in. Just some few things are there. Of course, the volunteers were there always to help them out. So it's not always need to be digital.
Can you guys hear me?
Yes.
Yes, not everybody yet.
I
think we're missing the tracers.
Yeah, Ramantha and Ramantha is.
Just one moment. I'll go ahead and mute that.
Okay. No, that's okay.
I think it might have been one of our folks has a corresponding meeting at the same time, so he has two computers going on.
Okay. No, that's fine. And the other one we also did was the digital signage. This is a good example of a digital signage. If you see here, we created if you created for the community emergency response team, like those are as you all know, many of them, FEMA actually provides this program for community members to help them out with a lot of different public health activities or anything else. So In that one, what we did was we created a simple playlist. We didn't create anything from our own. All we did was we created a playlist, and I can show you, and it's easy to create the playlist. Once you create the account, drag the slides, you save it and share it to your playlist, and then we made them play this on their site repeatedly. It loops on, it plays them, and you can see the list of slides. We said first thing we did was in Johns Hopkins University, there's a 1 minute information about the COVID-19 situation. Every day they update them, what's happening in US as well as abroad. Just a 1 minute update about COVID-19 is very crisp and point. So that will kind of keep playing. But also you also see that other important videos that from the local county, we try to put them from the local county or city, if any videos they have created. So in this case, Georgia's public health department, they created some of the videos were there. And then also we try to provide them, so that way people can see how these things are being done, how the vaccines, if there is any vaccine hesitancy is there, they can see all these things before they make up their mind to come and register them. So this allowed us to do those things, and also allowed us to play the videos after the registration. And if they need, while they are waiting, you can just, these videos will play them, what sort of side effects they may expect. And then those videos also would be useful for them. So any videos that you want to put them in playlist, but at the same time, we also did was explicitly, sometimes people may not open the playlist. We also try to provide them here. This is simple links there from where, important to tell them where it is coming from. As a source, always this credibility is important. And then if you see, we also say them, anytime you put the YouTube clips or anything else, people are worried about opening up a clip. They don't know how long it is. If anything more than 2 minutes, they're not going to watch. So usually it has to be less than 1 or 2 minutes. So that's why you try to provide them some sort of a way how long it is. And you can see the sources are coming from multiple places, Johns Hopkins, CDC, and then the local county, Georgia Department of they had made their playlist to be connected to their playlist. And then ad consoles, all of these things, right? So you can put them in there and for your settings there, you can do those. And then also a lot of questions were there about CDC for generally the vaccination things, frequently asked questions. So what we did was on the same Google site for that particular city, we put the URL for the COVID-19 vaccination page. Sometimes people get lost in when you go to the big sites like CDC, they don't know where to go, whether it is a healthcare or to the provider or the common public. So we provided the specific links there. You can embed the whole website into this, your Google site. It's basically, it's almost like a CDC built site. Website is here too. So you can navigate, move to any place you want, and whatever things are there. It's just no different than navigating your CDC website. But really, this place was about the vaccinations. At least you try to provide them all the FAQs before you get the vaccine and what you need to do, and those sort of things are there. So try to include them. And we also try to provide them the county's local resources, right? We want to make sure county's information, state information, and CDC information, wherever you need to create them, you can provide them. And you can see that in this case, we also said, since the site was created not by the city, but community emergency response team members, we tried to then this was created by community emergency response team members. In the same example here, current COVID-19 situation. Here what we did was the same slides that you saw earlier, you would have been seeing here, but in addition to it, we added other things related to, let me see if I can open this one. Yeah, from the county itself, sometimes they put in their county, they tell them every 3 days they provide the AP reports. You can take a snapshot of it and put them in whatever the time frame they had. This is what the case is increasing or decreasing. Plus you also can provide a link for them. All these things can be done. Of course, you can put a QR code if needed. And those sort of things you can do. And then also we try to put them information from anything else that related that they may wanted to know, you can put them in too. So yeah, so I'll stop here to see if I have any questions related to it and I can answer them. If not, then, and the same thing with the tribal community setting, one thing we found was with the vaccination, the same slide deck, we try to put them in the 2 counties, right? People wanted to know in a simple, plain language, because what their county is. Sometimes people may not be able to click the dashboard created by the state because they may have a low power internet connections. These ArcGIS dashboards can be a little bit challenging. So we tried to, we did provide the link for them if they wanted to look into it, but also try to simple provide them whatever the message for their county. So whatever the things are there. Same thing with the other county we did. Whatever the counties are, same thing, you would repeat them for other county. I'll stop here to see if any questions are there. Otherwise, I'll let Jennifer go through the next few slides related to the RMTLC so we can talk from there.
Any questions for Sudak about the examples that we just saw?
And I'll be glad to work with any of you actually if you're trying to implement the digital signage, so we can send you the device and just play with it and see, and then and also we'll help you put the content on yours, whatever content you need. Just we can provide some templates. We can share it with RMTLC so they can just help you too actually. So whatever the ways, especially for the setup and others, we can work with you as needed.
And that's one of the resources that we also provide is, curating content for folks specific to your tribe or specific to your needs. So one of the things that we're going to go through next is, your own branding. And part of the reason why this is really important is because, especially with vaccine hesitancy, people are more likely to take recommendations from the people that they know. So their own physician, their own tribal health clinic. They're going to take information from that rather than necessarily the CDC. So we want to make sure that we're all saying the same message and that we're consistent and that we build trust. So one of the things that we did with Rocky Mountain Tribal Leaders Council is provide a lot of educational resources. And these are just a couple of the slides of the things that we've done, but I'm going to actually go to the actual website here in a second. And as you notice that we have a ton on the list. And
so
then, yeah, sure. Okay, so we're going to the Rocky Mountain Tribal Leaders Council site.
Okay, just hold on. And this is the slide. Can you all see my screen?
Yep.
Okay, so I'm going to click on the site link. It's included in the PowerPoint slide. I'm going to okay.
Excellent. Yep. And so there's a whole list of these health education, and a lot of them are COVID related. But now that we are, all starting to recover from COVID, we're also providing other additional information. And so I know that a lot of these we've shared with all of you before, and then each tribe uses different things. It's kind of neat to see how they use it and how they post it. So every one of these educational sites are also connected to, so you want to show your OneNote also to show us about the QR codes?
Yeah, we can do that one. So let me show the RMTLC. Yes. Can you all see my screen? So we organized all the materials in OneNote. I think Jennifer can share the RMTLC's OneNote. So you can see an example here, right? So this is the top portion is the one actually you would want it to put them in a slide. You have a URL and you have we'll show an example too. And then you have a QR code for each one of them. And then also sometimes when you put the URL, people may not know whether to use it or not. So we took a screenshot of it. So the OneNote allows you to take a screenshot of any flyer or whatever it is. Everything you can embed them. So whatever the things, flyers and sheets, everything can be embedded easily from your website too. There's an app it's called OneNote Clipper. So it can be an add-on to your Chrome or even Microsoft Edge. So when you visit a website, you can just press the button clip and it automatically clips to your OneNote. So you can actually take the screenshot of the entire flyer, whatever things you needed. So in this case, not only the RMTLC, but we also have materials from other places. You can see Alaska, so all their materials are there. And the nice thing about this OneNote is it gives you all the materials. You can search them, and it also can be useful for people. Some people who may not be able to read, they can actually use it for. It automatically reads and also changes those things too. Let me show you an example here. When I actually opened it earlier, actually for the. So this one. Yeah. So this one example you can see here, just again, you can open in a browser or you can open in your OneNote application. So this is an example from Johns Hopkins University, one example. So this the whole flyer is there. I clicked on it and you have a QR code for it. You can put them in your slides if you need it. And then you can click on the immersive reader section. You don't need any attachments or anything at all. What it does is when you click on the immersive reader, and actually for somebody who's visually challenged, they can actually play this whole flyer, even though it could be an image, but it actually parses the image and then actually takes the text from the image and do those things. And you can adjust the speed for it. and you can adjust the and also the voice too, male or female voice. And you can see the entire content from this flyer is just very readable. And you can also say, change your text preferences. Whatever the text preference you want, size you want to increase, reduce, and change your background. Some people are wanted the black background with the white text. Whatever the text background, you can change them accordingly to those things. So it instantly gives you those 508 compliance, that sort of things. So you can actually use that one in these kind of contexts. And then also you can search across. So for example, in this case, I have the content from all of them. So I can decide to search only in RMTLC in a particular section, or I can search for across all of them. Whatever you want to do, it even searches the images. That's a nice, powerful feature that you can do, especially if you're collecting a more repository of things. Again, we included all these things, links as one of the resources. And let me, Jennifer, I will show your examples with RMTLC example. You have a small activity is there. You may want to take your phone and try to see if you can scan the QR code and see if it brings up. So that's something you can look into it. Jennifer, do you want to talk through about these 3 slides?
Sure, yeah. And so one of the things that we made sure with all of our educational materials is that we have a proper brand. So you can see the Tech Center's logo and then all of our tribes that participate with us. And then we also have in there contact information, because that's always really important to make sure that you have something else that a person can refer to. And then the next slide shows, I forgot what else we have in there. Each of these are PDF formats, and so they were easy to create. We have a really good health communications person, and that's Divya, and she can adapt a lot of these things according to each tribe as well. So if there's any specific tribal content that you would like to share, she can do those things. And we also can offer the service of, like, there's a lot of folks who sometimes cannot print these things out for them, or they may not have the color printers. And so if you contact the Rocky Mountain Tribal Leaders Council, we are able to also print and send those to you so that you can distribute. So we got a request from Little Shell yesterday for some cards, and Divya's in the process of creating some cards that will go out with household cleaning kits on a little how-to. And let's see, so these are all designed by a couple of our epidemiologists along with Divya, and most of them are PDFs because those are the quickest ways to and the most accessible, but you can also download these as JPEGs and put them on your Facebook sites, and also link back to our site where people can either see the PDFs or any accompanying videos that go along with them. So we have links on our own site that not only have the educational materials, but also links to the videos that you can then link to back on your Facebook or websites. And then some things that I wanted to show, and I don't know if I can show because I'm having a hard time showing my screen, was some neat ideas of how people have been using this information. Let's see. I'm going to go ahead and try and share. Is that okay?
Okay, that's fine.
Doesn't work. Yeah. Please work, please work, please work. It's not working.
Yeah, Erin may be able to share the screen too, right, Erin?
And I don't know if she's, so yeah, what I was going to try and go for was Little Shell's Tribal Health Facebook page, because they did a really good job of using like CDC links and articles and put it on their Facebook page. And so they don't have to actually create new content. They're just using the CDCs and promoting it through their Facebook page. And then the other one that I was looking for was Eastern Shoshone Tribe does a really good job of using this app called Poster My Wall. And when they have advertisements for events or new things, they use this Poster My Wall application to make it a more visual flyer. So there's animation, or like the one I'm looking at right now is an advertisement for the zone and opening up the gym and the 31-day walk challenge. And it's got fire breathing in the background. It's really cool. So Eastern Shoshone Tribe does a really good job with especially images. They do a really good job of making sure all of their posts have an image, because it captures people's attention so much quicker. And their most recent one is their health check station, which Fafa had me go through the other day. She's like, here, sit down. Let's take your blood pressure. Okay. It's really, so each of your Facebook sites are really great resources. And one of the recommendations that we also put on there was make sure you share the good news too. So like your successes, your community successes, your community stories, because there's so much on Facebook anymore that's negative that you want to be promoting the positive too. It'll be good for everybody's mental health.
So I think that's a good segue to actually show an example from a tribal perspective. So this is from Fort Belknap. All we did was take the images from their Facebook from the last few months. So that's all we did. We did the categories of all the images posted on there for COVID-19, but we also had things from tobacco and all the other stuff is there too. You can see whatever things they have posted, flyers, everything there. Each one of these content can be created into digital signage. So say you can see suicide preventions are there. And then some of them actually even have a videos. Like for example, they had videos. You can put those things too, right? This OneNote can be a way to organize the content, whatever things are needed, so you don't go and search and Google everywhere and do the bookmarks and everything else. Sometimes it's also always good to, instead of providing just the link, just putting a picture tells you, oh, this is what, these are the people who are talking. So it gives people an ability to see the videos. And a lot of them from Montana, they just from the state website, and same thing with the nutrition too. So a lot of nice things you can see how they have done and things like this. Some of the images are really wonderful actually. So it doesn't look very pretty, but at the same time, they're trying to convey the message. 400 calories of oil, how you can just, this is for the diabetes and diet prevention, that sort of things. They were doing 400 calories of chicken looks like this, 400 calories of vegetables, really fill your stomach. So those sort of the nice simple images that would work for the tribal communities you can use. And they pull it from different places, right? So it's not necessarily from a CDC website. So you can use these things. And same thing with the seatbelt safety. So for example, for the basketball season, they were trying to put them for the teenagers who are high school students, just to make sure that you can put them there. So there's nice set of images. I'm sure you all would have the same thing. You can use that one. Same thing with youth sports, whatever the things are there. And again, you don't want to put all the images of the health promotion. So for example, I put them in here. There, you want to put these things as a transition. Your images of that particular tribe's Facebook pages, all these wonderful pictures are there. You can put these things as a way, or if you have any other pictures, you can use it. Or if you have a way for people are sharing it to their website, your Facebook, if you're okay with sharing those things in your signage, you're welcome to do it when you also will provide some sort of an interaction with the community so they know that their content could be in a digital signage. So that's a good way of showing them. Yeah. So yeah. Anything else you want to add, Jennifer? And these are all the resources. Again, I'm not going to click on each one of them, but the digital signage one we showed was Fort Belknap example I just showed you is here. And then all the COVID-19 resources from other states. Again, we didn't put exhaustive one. We just put some Montana and a few other states we have put them in. But RMTLC is going to give a link for their content. All the content, what they had, every one of them would have their QR codes and flyer and the links, everything would be there. And these are the other links you can look into it too. Yep.
Okay, so we would like to open it up to questions for folks. Questions, comments, ideas, like if you've been doing something that's really successful, we would like to know as well. No questions, no comments, no like, hey, this is what we're doing.
And also let Jennifer know if you all need any help with trying to put them together. We can help you with creating the template or provide some assistance related to these devices, depending upon each setting, right? So we can work with you what would be best for you.
Well, folks, since we are having one of those Thursdays where we're just going to be a little bit quiet, that's okay. Make sure that if you do have any questions or concerns or ideas or need some assistance, please give us a holler and we will absolutely help you. I know that Aaron's said, hey, David, we're going to totally give you a call and make sure that we can provide some additional information for you. We really appreciate everybody being with us today, and I hope that you have a very blessed day.